Hi, my name is Janet McKee, and I am submitting a proposal to speak at NATSAP about nutrition. The topic of the conversation or the presentation is nutrition. You are what you eat. This presentation will focus on explaining how nutrition plays a vital, evidence-based role in the development of children and young adults cognitively and physically. It will educate the participant in the area of nutrition and how it relates to recovery rates. For example, evidence-based literature now embraces nutrition as a very vital part of a treatment plan for learning disorders as well as substance abuse disorders. Evidence-based literature shows that eating a healthy and wholesome diet has huge potential for positive outcomes. For example, children that struggle with substance abuse and learning disorders are at risk nutritionally due to poor eating habits. With good nutrition and fruits, vegetables in a methodology that they will consume and eat will and can deliver positive outcomes for that child. We are what we eat. Our brain needs 50 different nutrients day in and day out. We can't get that from cheese puffs, cheese doodles, and soft drinks. And that is what many of our at-risk Asperger's, autism, attention deficit disorders, and many of our participants in the therapeutic boarding school and residential treatment facilities, that's their diet. This is an opportunity for you as the owners and participants, therapists, and program directors of therapeutic boarding schools and residential treatment facilities. Learn about how to engage nutrition as part of your program to produce the outcomes that you need and want, and your participants need and want. Nutrition makes a difference. Children that have medications for depression, for attention deficit disorders, for Asperger's, many times they benefit from a gluten-free diet, a caseinate-free diet. Many times we see that making the correct carbohydrate adjustment with an antidepressant will bring that child to a higher level of cognition and really take the next step toward the recovery process. Good nutrition helps maintain recovery. Again, it will teach you all about that, the vitamins and the minerals nutrient-wise that are necessary, but also the part of the presentation will be talking about how do you take these concepts of good nutrition, vegetables, fruits, how do you bleed them in your menu? How do you make this a win-win for the participant to consume them and to produce a menu that's appetizing and looks great to get people to want to eat your food? Healthy is great, but if you can't get them to eat it, it's a problem. It will also focus on how to make gardening, good nutrition, organic nutrition, wholesome nutrition part of your plan. It will discuss how planting tomatoes, cucumbers, vegetables, and fruits in various periods, a winter garden inside, a spring garden, a fall garden, how engaging the students, the teachers, the therapists in that process is a soothing and calming effect that also can support good cognition, a learning experience, and positive outcomes. How do you take farm to table that you grow yourself and bring it to the table? And how do we deliver what our participants need is good nutrition to fuel their brains and bodies for good school performance, good cognitive performance, good recovery rates, and to be the very best they can be. You are what you eat. Thank you for your consideration.